All right, good afternoon, everyone. We will get started. I want to warmly welcome all of you and thank you for joining this meeting. At this point, I'll invite Victoria to kickstart this meeting. Victoria, please.
Thank you so much, Victor. I want to say a very big thank you to everyone who has joined our session today. I want to say we appreciate your presence here and thank you for joining. Welcome to the Bridging Leadership session about COVID-19 in Nigeria and building multi-sectoral collaboration in the country. My name is Victoria Fajemile and I work as policy advisor here in Nigeria. So quickly, why are we convening this meeting? Why have we called upon different stakeholders to be in the room to discuss about collaboration in the time of COVID-19? I think we would all agree that, of a truth, COVID-19 has shaken our world and we've had a lot of reactions from nations and from people about handling this pandemic and how the economies have actually reacted to it. So we've called every stakeholder in the room today to talk about how we can strengthen collaborations in this time more than ever before, because we see that the diversity that we have has actually been more pronounced in this time. And more than ever before, we need to build trust and create greater collective action for people in the room. So how do we live during this COVID-19 world, but also post-COVID-19, what would the new normal look like then? So what do we have on the agenda for today? We've had our welcome statement by Victor Adejo, who is the country director for Senegos in Nigeria. We'll also be talking briefly about who we are as Senegos globally and also who we are here in Nigeria. After that, we'll talk about COVID-19 and how it's been like in the country. We'll then be moving on to talk about the issues and challenges that the sectors have had to face during the COVID-19 time. And this panel discussion will be led by Victor, where we'll also talk about our work in Nigeria and then move on to the second panel discussion. At the end of both panel discussions, you'll be able to drop your questions and we'll be able to address those. So, I'm sure if we ask everybody in the room if you heard about COVID-19 or coronavirus, probably this time last year, it was probably a novel concept, something we probably did not hear about. It probably just sounded like a pandemic, a term that we could find in the dictionary. But now more than ever before, it is a reality. And in Nigeria, we've had about 11,000 cases since this started. And though our first case was just in February, we've had an increase in the number of people who have been infected with this disease over time. However, Nigeria is a country of very diverse people, and we have about 200 million people in the nation. The test that we've been able to carry out, however, just inches close to 60,000. That shows us that barely a percentage of our population have actually been tested for this disease. And this goes on to show us that even as countries are closing up and opening up their economies, there is need for greater trust and accountability in the government. As a result of the infections and the breakouts, the government of Nigeria has had to give a lockdown order in Lagos, Abuja, and Kano. Most of these lockdowns have been lifted, and we've had some curfews in place, certain segments of the population opening up and the economy. But I think the key word is caution. We're still being told to keep social distancing, ensure we wear masks, but this can only be effective if we have a bridge gap between those in authorities and those who are the citizens. So here we have a slide speaking to what we think the major issues are about policy, about how Nigeria has a large informal economy, about limited access to basic resources in the country, and the fact that this is something that we have to actually nip in the bud going forward. We have to have greater healthcare systems. We have to have greater accountability both in the formal and informal sectors. So how do we do this? What is the role of Senegos? And how do we carry the stakeholders along in the work that we do? So this is where Senegos comes in. For the past 30 years, Senegos has been working on complex issues across the world, making sure that we promote bridging leadership and build trust and collective action among the stakeholders. So our belief is that solutions that are crafted in silos can only go so far. We need every stakeholder in the room to be able to talk about themselves as part of the problems, but also as part of the solutions. So we are big on inner work, we are big on collaboration, we are big on bridging leadership. We believe that when we create an enabling space for people to come together and discuss the issues that they are facing, we're able to actually create multifaceted solutions for them to look at. So we don't work alone. We always make sure that we have people in the room who can address these issues. And in the spirit of that, we have an impressive list of panelists in the room today. First on the list, we have Honorable Ajia Alima Lawal, who is the Commissioner for Agriculture in Kaduna State in Nigeria. She's an avid gender advocate. She has a first degree in agriculture, and she's worked in the Central Bank of Nigeria in the past. We say a very warm welcome to you. Also on the panel this afternoon, we have Professor Andrew Zamani, who is the Director, Institute of Governance and Development Studies at the Nasarawa State University. He is also a member of the Pan-African Psychology Association, and we're happy that he's been able to join us on the panel today. Third on our panel list today is pharmacist Asma Begum Mirza. I hope I got your pronunciation right. She's a highly motivated businesswoman who's worked in manufacturing and pharmaceuticals over the years. She's a trainer on diverse topics like healthcare, managing HIV/AIDS in rural locations, and she's based in Kaduna State. Also on the call today, we have Dr. Omede Ogu. Dr. Ogu is the Director of Programs, Health Future Solution Initiatives. He is a medical doctor and he's a public health specialist. He's passionate about public health, program management, and he has experience in environmental epidemiology. I understand that we have some of our panelists in the room already, who Victor will be speaking with, but we're also expecting some of them to join us as we go ahead on the call. So thank you to everyone, and Victor will be taking over from here. Thank you.
Thank you very much, Victoria. That was great. Once again, I welcome all of us to this meeting, and for us to have a great meeting, we would like to inform all our participants that they are welcome to ask their questions, especially questions targeted at the panelists. You could use the chat room and able that we get your questions clear and concise, and our panelists will attend to your questions. My colleagues are also working to ensure that we address all questions that are asked. On this note, I welcome all of us to the first round of the presentation. And I would like to start with the Honorable Commissioner and engaging from the agriculture sector. It is true that the fight against COVID needs a multilateral and multi-sectoral cooperation, and everyone must support it wholeheartedly. And so we're looking at how possible and what is required if building trust can provide coordination. And so, Honorable Commissioner, ma'am, the lockdown has prevented a lot of activities in the informal sector, as we have mentioned, and agriculture seems to take the biggest share of the informal sector in Nigeria. How have you been able to address the challenges that have come from an institutional perspective in a way that handling the effects of the COVID and also the impact it will have on citizens. What have you been able to do thus far? Honorable Halima.
Good afternoon once again. It's not breaking news anymore that C-19 has disrupted agriculture, supply chains. It has brought to the fore our poor and vulnerable communities, not only in Nigeria, worldwide, but particularly in Kaduna State. We identified our value chain actors. We recognize that our stakeholders from both the upstream and downstream would be affected by these disruptions. And the first thing we did was to get exemptions for our farmers, our development partners, such as Senegos and Agra, and others, of course, our processors, everybody along the value chain, because we classified agriculture as an essential duty, essential sector. So part of what we did was to make sure that movement was minimally disrupted. Of course, because of the lockdown, there was a lot of outcry. And this was even more benign for us because it was just close to the cropping season. So we were faced with the challenge of making sure that farmers had access to inputs, that they could go to their farms, even go to markets to sell some of their produce so that they can buy these inputs. So we did that with continuous engagement with our communities, with our sister agencies like our Ministry of Internal Security and the Ministry of Business, Innovation and Technology. So we're getting exemptions, we're getting passes. The government also was very fast in making sure that we were able to distribute some palliatives to our most vulnerable communities. So it was a systematic approach, and we made sure that this was done to the last mile. So for instance, when we were able to get some inputs for these communities, we made sure that we made it available at one point, at one location, so that their movements were minimized, so that they wouldn't be exposed to too much danger. So if we had fertilizer in one location, we made sure that we spoke with our seed companies, we spoke with the agrochemical companies to please take those the products, their inputs, to the point where we're selling fertilizer, so that our farmers would have less exposure to dangers, because of course lockdown also came with some security threats. Again, we're looking at protecting the value chains by making sure that we strengthen the participants through our media briefings, our radio outreach programs, informing them of what they should do at any given time during the season, so that they didn't have to come to our offices to seek information. So we're taking that information closer to them, all in an effort to minimize those disruptions. Of course, we know the challenges they have besides infrastructure, security challenges, inputs, and even the weather. So we were telling them about how the weather was going to be like when you're supposed to plant. And that was done through our collective effort, through our collaboration with our development partners, like I said, with our other agencies. And even at the office, we now were able to continue in governance by making sure that we're having virtual meetings. We're doing a roster of staff that could come to the office and attend to some queries that people otherwise wouldn't have been able to access those information through the virtual media or through any other means. They are so used to coming to the office. So we're always continuing to work for 2 or 3 days during the time that the government had those 2 days open. Right now in Kaduna, we have 3 days open, and we are looking to ease down the lockdown in appreciation of the fact that we must ensure that we continue our activities. Otherwise, we are going to face food insecurity. And Victor, you mentioned the informal sector. I know they are the most vulnerable now because they have to go out daily to get some income. and as a result, they lose some income. They have a shortage of food even to feed their families. And those smallholder farmers are the ones that actually feed us. So we made sure that with our collective effort and wholehearted collaborations with all our partners, be they research institutes, other ministries, even commodity associations, we were given the required information. And I must say, I'm quite pleased with what progress we've made so far, because from the information we're getting back, everything for now is going smoothly. And I hope that with continued efforts together as a collective, that we can also make sure that we have a productive farming season this year without too much disruptions. Thank you.
Thank you very much, Honorable Commissioner. It's really good to hear from you. We will look at issues around mental health and wellness. And there have been spikes of behavioral issues and social issues that have to do with families as a result of the isolation. Professor Zamani, how have you, as a psychologist and perhaps with your team, been able to support citizens to adapt to the new lifestyle changes? And some of these changes as a result of, one, the fear of contracting the virus, worries about people close to us, and again, particularly people who are very vulnerable. Our reality today is around the fact that many people are working from home, and a lot of people have also temporarily lost their jobs. It's been reported today that about 1.4 million teachers are currently unemployed. And in the last few weeks, we've been hearing cases of rape. Please share with us.
Thank you very much.
What your thoughts are. Thank you.
Thank you very much. I'm pleased to be with you and to share my thoughts on this very all-important issue. COVID-19 has really brought untold hardship to the citizens of Nigeria, and indeed the entire humanity. There is no gainsaying the fact that the first issue to challenge is ignorance. We have had in the past few months contradictory information and attempts by people of all callings to educate citizens about what COVID-19 is. With the result that the true information and the misinformation that have been shared in the media and through various other fora have ended up confusing Nigerians. And indeed, in other developing countries where this issue is yet to be effectively tackled. So ignorance is one issue that psychologists are really mindful of, because it is a very big barrier to the interventions that would eventually be made to assuage the situation. We have observed also that relational skills with persons in isolation and even confirmed cases have been an issue, both within the family and between these index cases or suspected cases with frontline health workers. Right now, all over Nigeria, there is another pandemic, which is contamination neurosis, one that makes us fear each other, one that makes us not to like to relate in a very free manner with each other, for the mere fact that we suspect that the other person, is COVID positive and could actually infect us. Now, this is not to say that precautions are not necessary, but the way and manner people meet each other these days, their attitudes towards each other, which conveys suspicion, which conveys fear, which actually also conveys disdain, is something that we note which should actually be dealt with. There is also frustration due to access to treatment accessories, such as drugs, such as ventilators, and protective services. These issues are there. The issue of death anxiety is there. Caregiver stress for frontline health workers is there. The burnout they suffer and compassion fatigue that results from the services that they offer are also things that we note that have to be addressed if we must win the fight against COVID-19 pandemics. Now, another problem that we have observed, which requires attention, is the disclosure skills of people who test for coronavirus. Most of them do not have adequate human relation skills. They are not psychologically minded. And so they treat people that they test more or less as objects rather than humans. And so the conveyance of results, or even the preparation to take the results, has been fraught with a lot of inhuman tendencies. And so from the onset, people are not prepared for prognostic outcomes. And then finally, there's the need for us to really begin to think about welfare issues such as insurance for frontline workers, including security agents, and extra remuneration, which partially has been addressed by the presidential task force on this issue. Now, there are cross-cutting issues, with regards to the management of the entire COVID-19 pandemic response in Nigeria. One is, do we have health information tools? Are we developing health information tools to support our health information systems and to enable our public health practitioners to devise models of intervention that would work? Number two is the issue of strategic communication for behavior and attitude change. We have not seen any effort by government in that regard. We have NOA, the National Orientation Agency, which should take the largest brunt of this. But what do we see? We just see government officials who feel that they have the right to force down information and to tell us anything they wish to tell us without evidence and without the mindfulness for the emotional and social effects such information that they pass on us have on us. So invariably, you have people developing resentment rather than getting prepared to accept this information as real, as true, and as strategic, to affect the steps that they take to keep safe. Now, we do not even have community resource mobilization for positive social action. the advocacy with regards to what should be done to affect the people at the grassroots positively with regards to the provision of palliatives, with regards to facilitating their access to human and social services, are not just there. If they are there, we do not have adequate information about that. And so these constitute barriers to the effective response of government and at different levels, to this pandemic. Now, what is the result on a typical Nigerian? The result is mental health confusion. The result is anxiety. The result is proneness to depression and other related mental health issues. So what have we really done? We have mobilized psychologists to provide telecounseling. We have mobilized psychologists to provide emotional support for frontline workers. We are working with security agencies so as to fine-tune their behaviors with regards to the lockdown rules and regulations.
Thank you very much, Prof. We truly appreciate your contribution. It was really comprehensive. Thank you. And so we'll be looking at issues around drugs and food. It is clear that the lockdown has triggered by COVID-19 has led to disruption in health, nutrition, food aid, school feeding programs, and as well as the social safety net. It is clear again in Nigeria that the lockdown has also resulted in limited access to food and the supply chain. Pharmacist Asma, how would you, in your own reflection, tell us about how these issues and challenges have been handled and where you think the biggest challenges are? Thank you.
So, good afternoon, everybody. I'm happy to be here, and I want to thank you all for coming up with this initiative. I would like to make some serious observations. Even before the COVID-19, we had figures of malnutrition and so on, which were horrendous. Like you have 37% of our children malnourished, resulting in stunting and wasting 7%. Children of between 6 and 23 months old, 34% do not have micronutrients, and so on. So with this, of course, the present situation, it has compounded all this and bring the big figure. We have not done the, I believe, figures yet, but I'm sure they're bigger. That is the negative. But I'm sorry, some people might not like this, but there is some positive aspects of COVID-19 too, because the way the Al-Majri system was sanitized and all the kids were sent back to their parents, if it hadn't been for COVID-19, it could never have been handled. It was brought to a complete, what would I say, upside down, positive way. And every child was taken care of, at least in Kaduna State. They got them all, they put them in quarantine, and they fed them, they clothed them, and now they're working on how to get them to their families and how to get them into schools properly and the proper education system and so on. I think that's a plus thing. But then let's come back to the problems created. As a pharmacist, as a farmer, and as a citizen, the the issue of the farmer, yes, it was handled very well. I personally went out as a farmer, carried my produce. This season, the honey is just about to, you know, we're supposed to stop harvesting by now. So there was a lot of movement because of honey. And I took my honey, brought it and took it out for the retailers and so on. Nobody stopped me. That was wonderful. I didn't have any COVID-19 card or anything. So yes, the farmers were well taken care of, very good. Then coming back as a pharmacist, my heart bleeds. There is nobody making drugs. Most of the drugs come from somewhere, maybe mostly Kwara or Lagos or southern part of Nigeria. Here in this part, we have very few manufacturers. Of course, they cannot produce to capacity. Then there was a lot of disruption in the sense of when you make a pharmaceutical, you have to put it in a container, a specific one. There are particular parameters you must, you know, satisfy. It was so hard to do all that during this time, but eventually it eased out. Fine. But then we do not make deliberate efforts to see that we produce at least the basic drugs. One, drugs. Two, supportive food. Things like ready-to-use therapeutic food and so on that can be given just like we're giving food palliatives. The other food that can prevent people from going into the stage of hunger. You know, you don't let them deteriorate to that extent. Thank you very much because I'm trying to say thank you to the commissioner. She used the word community. Yes. The local governments are very big, so you must target on communities. Why can't we make a system in which we look at communities and we look at the vulnerable people in the communities and see who needs to be supplemented with nutritional food, not just food, to prevent them from going into that phase of hunger, from wasting, from the kids becoming stunted. And there's another aspect that people don't talk about. It even prevents your mental development. When you're hungry for a long time, you don't have so many nutrients missing, then you don't even develop mentally. Do we want to see a third of our population stunted and mentally not, fully developed? That would be a very sad situation. We need to work on that. Maybe we can, strategize and come up with ways of handling it at a community level. What is it that is lacking for them and we need to supplement it? We could look at that and work out foods and drugs and stuff for particular areas, specific, targeted. But all this, again, you see, you have to feed people, you have to keep them healthy, then you have to supplement, and you have to have drugs for diseases that are common. And all this cannot be achieved without proper education. Education doesn't always mean a certificate thing. To educate people to think in a certain way, learn some certain survival skills, formulate things that at family level, it's still education. Yeah. So all this is interconnected. We must sit down and form things and think of strategies that can help our people in our own ways. I've noticed something that I'd like to point out. Sometimes there's a complete copy of what is happening in another place. Fine, it works for them. But we have to look at things that work for us, specific to our needs, our people. It could even be different from one community to the other, because there might be a specific thing they lack in this place that is in abundance in another community. So the same thing doesn't apply to that, to the two different population groups. Then I would say maybe there should be an effort, a deliberate effort in putting up groups of people who might be interested in manufacturing things like pharmaceuticals, like food supplements, like vitamins, then the fact that this movement has been restricted, in some ways it's good because it's going to prevent, you know, contamination, and you can contain things and you can actually target populations and achieve your results. I hope I've been able to communicate something to somebody out there.
Thank you very much, Asma. We really appreciate, yes, your presentation came in really wonderful. Thank you for your wonderful comments around connectedness. Thank you for looking at avenues that we and all critical stakeholders are able, the civil society and humanitarian support. And we have Ambassador Peter Eguda. Peter Eguda is an ambassador of peace in Nigeria. Mr. Peter, we are aware that government has made several efforts to support with palliatives, and we've heard that several families have been registered. There are critical issues around the over 2 million IDPs in the Northeast. Do you see trust as an essential ingredient from a civil society perspective that will enable those who have been affected by the various crises in the Northeast to get necessary intervention?
Well, thank you, Victor, and thank you, everyone who is on the panel. First and foremost, we need to understand that we are dealing with a crisis in our hands. And the government of Nigeria and other states and the state governments alike have all worked hand in hand to ensure that the spread is nipped in the bud, and especially that people who are affected, especially significant numbers of our populace who are living below $1 in a day, are taken care of, which is what the palliative actually was meant for. But from our own personal experience, working experience in IDP camps in the northeastern part of Nigeria, which has been under siege by the activities of the Boko Haram insurgents for over 4 years now, you will agree with me that adding the pandemic to the existing crisis in our hands became a catastrophe to deal with. Vis-a-vis, you're talking of IDPs who have been displaced before now, their means of livelihood distorted, and virtually everything they own has been deprived, taken away from them by the insurgents. Now we have a pandemic that is not only killing them, but also putting them at perpetual stagnation because they cannot even go out to make a living. That is the situation we find ourselves. However, we all need to understand that the IDPs themselves also are human beings like us, and they also have rights. In our own experience, we think the palliatives have not really touched the most needed in our society, the most vulnerable in our society. And this is because government, the way it is programmed, the way our government operates, our government is so large, even before the pandemic itself. People are not really benefiting from most of the things that governments put in place. Take, for instance, the social investment plan of government where 10,000 was given even before the palliative came, even before the COVID-19. How many of our citizens are able to key into that good gesture of government to benefit from what government is giving? We've always seen that in Nigeria, it is only those people who don't even need such palliative that get it at the end of the day. With due respect to our government, whatever good intention they have most times, the operative of governments most times abuse the trust and privileges that is being put on their shoulder to rich people with such largesse of government. And if you also look at after the pandemic, even after government may have come up with a palliative structure in place, as we speak, a lot of our citizens are not still able to benefit from it. You go to states, you go to local government, there are lots of complaints here and there. And this is largely because of the weak structures we have as a country, as a state, as a nation, not just because of the pandemic, but because we are not programmed, we are not wired to actually deal with these issues. For instance, you go to other climes like the United States of America, they know everybody by his or her address. They know what you do. And so when governments want to give palliative, it's very, very easy to touch you, to come straight to your doorstep. That is not the case with Nigeria. and of course, in our communities as well. Part of the problem we also have is that even in the response itself, as a nation, you find out that there's no clear-cut coordination between the state government, federal government, and the local government. And these are governments at different levels that actually take responsibility and ownership of responses in the geographical location which they control. So we have the PTF sitting in Abuja, dishing out controls and giving us information, just statistics. Most of the state governments, some of them are not keen in, some are keen in, some are even politicize it. For instance, you take the state, the case of Kogi State, that up to this moment, they are still dealing with whether there's COVID in their state or there's no COVID. It's still a crisis between the federal government, the PTF, and the state government. And likewise, if you go to some of the state government, the local government's chairmen or authorities are not also being carried along. And that also comes to the issue of perception, where people, as we speak, a large chunk of Nigerians still don't believe that the pandemic itself or the crisis is contagious even. There's issue of perception because of the way the political structure has managed the pandemic, as it were. But looking at the Northeast specifically, because it comes with its own kind of issues, talking about the Boko Haram insurgents, talking about IDPs that have been displaced, and now the pandemic. The good thing that we see is that there's a concerted effort by some of the state governments, especially the most affected states. We call them the Bay States, Borno, Adamawa, and Yobe. These are the three most affected states in the northeastern region where Boko Haram has affected. You could see that the political leadership there has really put up structures in place. They have COVID-19 committees led by the state governments, high-ranking government officials. But one other green line then for all of us is that because we have a larger number of INGOs, United Nations system, and local organizations who are working in this region. And already they have a lot of they have structures on ground that have been dealing with this kind of issues even before the COVID-19 issue came on board. So those structures are what we are leveraging on currently, because we have intersector working group comprising of the government agencies, INGOs, the UN system, and the faith-based organizations, community-based organizations who are working across the communities in the northeastern part of the country. So the CSOs and the NGOs alike operate in a kind of a network-like, where they also have their own situation room to complement what government is doing. But that aspect also is not also a guarantee that the pandemic is not spreading. Now it has moved to community infection rate. People are being affected not because of their travel plans, but just because they're in their community, they are affected as well. Not necessarily that they travel out of Nigeria coming in, but now it has come to the community and they are being affected drastically. So our concern now is the information dissemination strategy between the government and those ones who are operating in the field. How do we share this information to the communities for them to agree that COVID-19 in itself is not a myth? It's a disaster, and we need to work towards it. Yeah.
Thank you very much, Ambassador Yeguda. It's very helpful, the contributions you have made. We have seen where collaboration is working and the gaps that you have also identified, and where necessary for us to pull the strings to build trust. We'll go to Dr. Ogu. Dr. Ogu, there is a worldwide shortage of masks, quality test kits. There are policy gaps and infrastructure. In your mind, how can we effectively move beyond COVID-19 without trust in the system in a way that we work collectively? What will your reflections be around what is happening in our health system and its inability to meet the current challenges? Dr. Ogu.
Thank you, Victor, and my apologies for missing my position. In terms of public health response, I would like to begin this way. The estimated population of Nigeria today in 2020 is 219 million people. The first index case for COVID-19 came in precisely February 27, 2020. Between that time and now, estimatively, is about 3 months. As at yesterday, records put it that about 69,000 people have been tested, total tests. that does not represent the people. It's the progress that has been made in that area of testing, because testing comes under early detection. Early detection comes under a category called control strategy. The adoptive public health response for COVID-19 is not restricted only to Nigeria. Globally, is a suggested strategy that has been pushed forward by WHO, and it forms majorly under 3 categories. The first category is control strategy. The second category is non-pharmaceutical intervention, which we codename NPIs. The third category, which is also final, is the pharmaceutical intervention. If you look through all of the 3 categories, Nigeria as a country has made a lot of progress. Let me begin with the control strategy that has to do with the following: early detection. Labs have been set up across the country that have been accredited to carry out COVID-19 tests. And most of the tests that is currently happening in Nigeria is PCR tests. A component of that that will inform a national algorithm for diagnosis is the rapid diagnostic test. That so much progress has not been made, not only in Nigeria, but globally. And based on the PCR, I have told you that yesterday, the estimated figure of people that have been tested totally is about 69 people. And I mean, 69,000 tests. That does not represent people. On the average, an infected person is entitled to about 3 tests. So if you compute this is 9,000 by 3, if you come to an average of about 20 to 30,000 people being tested in a population of 290 million. Simple arithmetic will give you what the gap in the area of early detection is.
Okay, could you speed up, and so we'll be able to see clearly what those challenges are?
Following that is contact tracing. Contact tracing is very huge. The method the country is using at the moment is effective, but it could be improved upon by converting the analog to digital. And following that very closely is healthcare infection prevention control. That also, a lot of progress has been made, but there are rooms also for improvement. Clinical care is ongoing. A lot of recoveries have been recorded and reported. Community engagement, I've heard various people talk about, is key. And the country also has, through the Presidential Task Force, has consistently, using the media platform, informed the people on guidelines and on steps to take and giving update on things to be done. In the area of non-pharmaceutical, you know, the PPE is coming. The hand washing, cough covering advice, stay at home if ill, wear masks if ill, and wear masks in the community also if ill. And wear masks where people in the household, if there's anybody in the household is ill. So that comes under the non-pharmaceutical. And a lot of progress also has been done. We know the general shortage of PPE across the globe, so not only restricted to Nigeria.
Dr. Ogu, I'll come back to you shortly. Okay.
Okay.
I'll come back to you again. Professor Zamani, can we have your final words? What do we need to bridge the leadership gap in 1 minute? Professor Zamani.
Having me back again. What we need to bridge leadership gap is multilateralism. We have to work in different sectors, bring in diverse ideas, diverse resources for a common purpose. If we do that, I think we will win the war, not just against COVID-19 pandemic, but other developmental issues, both health related and economic.
Thank you very much, Prof. Honorable Commissioner, if you're still here with us, how can your sector reshape the economy? So, where do you see trust building in ensuring comments like, we prefer to die by COVID as against hunger that is all around? How are we able to build citizens' confidence that has resulted in negative thoughts around the confinements?
Thank you very much. I think principally before the confinement, most jurisdictions just went into action, but I do not fault them for that. I guess it was an emergency and it needed drastic measures. If you remember how we did with Ebola, the primary thing would have been to, like Asma said, to educate people. But I didn't think we had time to do that education in this instance. All the same, it's to build that resilience. As we go along now, people are realizing, maybe you might consider it it's too late, but people are realizing the wisdom in taking those measures. So that building of trust, that continuous engagement, a common goal, people are coming to the realization that we needed to take those actions. And of course, when we were all going into lockdown, nobody said, I'm going out to go and buy a car or shoes or clothes. Everybody was running to go and buy food and foodstuff to keep. And now together, worldwide, I think we have realized that agriculture is the way to go. That's our only way out. Even when you are taking medication, sometimes they have to tell you have to eat to be able to get treatment, or you must take some certain diet to supplement the drug course you're taking. So Victor, I'd say that we need to do continuous engagement. We have to have a wholehearted approach. A lot of panelists have said we must have trust. So if we have that trust amongst us and have a common goal, we should be able to come out of this. And even as we speak now, we are engaging more, because that engagement, you can't say, oh, we did one engagement and that's it. It is continuous. So we need to be that resilience to maintain that dialogue amongst us. And even with our traditional rulers, so we must segment, just like we segment our agri-value chain, we must segment our stakeholders. So we talk with our traditional leaders, we talk with our religious elders, we talk with the youth, we talk with women, farmer groups, everybody. So if we keep on talking, we will come to the same common ground, and we should be able to come out of this, and agriculture would take its rightful place. And we'll all come out healthy. Thank you.
Thank you so very much. Thank you, Honorable Commissioner. I want to also thank our audience for staying still and listening carefully. We welcome you to go into the chat and write out your questions there, and let us see how we can provide possible answers to your questions. Synagogues in Nigeria, worthy of mentioning here, has a proven track record of delivering effective programs and also advisory services in partnership. We have worked in several projects. One of them includes the State Partnership for Agriculture, funded by the Bill and Melinda Gates Foundation, targeted at 3 states, and we have been able to bring all key stakeholders together to build effective collaboration and partnership, and also look at how the system can shift from agriculture as development to agriculture as business. We've also worked on an advisory project in the office of the Federal Ministry of Agriculture, in the office of the Minister of Agriculture, providing advisory services that enhances quality deliveries of government plans and priority at the national level, and also emphasizing alignment between the state Ministry of Agriculture and the state and then the federal policies. We're currently also supporting the Kaduna State Ministry of Agriculture as well as Niger State Ministry of Agriculture on a program funded by the Alliance for Green Revolution in Africa, AGRA, to enhance and strengthen the capacity of staff of the ministry. And one of our key projects, which has to do with high conversion of cassava peels to livestock feed under the High Quality Cassava Peels Project, funded by the African Development Bank, has seen us scaling up to other states and creating new streams of livelihood. We will go back as we continue to look at the questions. If there are any questions at the moment, I'll invite Dr. Ogu to really share with us. Our health system has come under a huge pressure. In 1 minute, where do you see us working on the leadership in our health system in a way that the citizens, again, can reawaken their trust to be able to rely on our healthcare system?
That will have to do with extensive review of system, look at areas where there are gaps in the system and strengthen, because without a system, delivery will be difficult. And the system is made up of components. Then following that is management. Identify key management and their key critical linkages, and then strengthen them effectively to deliver on goals and objectives. Thank you.
Thank you so much. With that comment, Ambassador Yeguda, what in your opinion will be a good platform, giving physical distancing and social distancing, to be able to engage with all the stakeholders in the humanitarian sector and in the civil society in a way that trust is enshrined?
Yeah, for us to move out of this, trust needs to be built. And for us to get to that level where we have to agree with one another, is to also identify the strengths of each and every one who is involved in this, in the fight against COVID. We have already existing structures like the National Orientation Agency. None of us have heard much of them in this pandemic. They've not been up and doing. Could it be that nobody has invited them, or they're underfunded? That kind of structure is a structure that was supposed to be utilized properly. We also have faith-based organizations who are scattered across Nigeria in all the nook and crannies of the country. They are very powerful. They have a voice, either from the Islamic side or the Christian side. These are critical assets we have as a nation that we're not utilizing. We also have the non-state actors comprising of market women, the civil society organizations who are also scattered across the country. They've been doing something along this line, and nobody has really keyed into the potentials they're in. So we need to bring everybody together to speak with one voice so that we can curb this. Like I said, the issue of myths, the issue of perception is still very high in our community. And until that is broken, we may not see the end of this in the nearest future, at least. Not to talk of the infrastructure decay that we have, but the people's attitude need to change. And that's why that trust needs to come in. Thank you.
Thank you very much, Ambassador Yeguda. Speaking about trust, the food and drugs we have mentioned plays a very important role. And there are comments from certain quarter insinuating that if we do not quickly set out in good time, we're likely to have food insecurity. Given all the efforts, Pharmacist Asman, what in your mind will be the best way to engage with all stakeholders cutting across food and drugs in a way that citizens become more aware of necessary actions and steps to take?
I would really want Ministry of Agriculture and Ministry of Health and Education to somehow form a network in which they can educate people. You can actually calculate and tell a family that you must grow, they should specify, you must grow soya bean of this so quantity to give yourself protein at least this much. You must have this number of chicken, because most of our population in the rural areas is where we have all this malnutrition and we have all this micronutrients lacking and so on. And there's such, abundance of everything. It can grow, it can happen. It's just that there's nobody to give that direction. Facilitate it for them. First of all, you have to plant the seed, the thought in their mind that you can do this in this way, and then you can help yourself. You can grow it yourself. It could be small animals. It could be plants that are highly nutritious first you must save yourself and your family. Grow this. Keep this at home. People have tons of honey. They just sell it. They don't use it. Why? I stay in the village part of the year, and every family grows chicken, but I just do never see them. In fact, I had to ask that how come I don't see your children chewing bones, walking around, these small tiny ones? Why? I see chicken, quite all right. No, we sell it in the market. No, you have to educate them that you must feed your family so amount of protein, and the protein is available in this and that. You must give them this and that to make the nutrients, the vitamins, and so on. Otherwise, you will have to spend on drugs. We don't want to spend on drugs. We want them to eat healthy. So there has to be an education. Since they cannot go to schools, maybe there could be a way through radio, television, or some other ways that the Ministry of Education could put this together in the shortest possible time in collaboration with the agriculture and health to determine how and what they can do for themselves. It can be done. Then you think about all the commercial stuff, how you can sell what. But right now you have to look after your family. I hope I'm making and talking sense to somebody. I don't know.
Thank you very much, Asma. We hear you loud and clear. And you know, when this whole pandemic started and how we're looking beyond the pandemic, the health sector seemed to have taken a center stage. Reports as at yesterday indicates that over 800 medical personnel have either died or are currently affected by the pandemic. Dr. Ogu, it will be good for us to understand how the governance structure in the health system can indeed bridge these gaps. I mean, there's a lot that needs to be done. And now that our health systems are overwhelmed, it will be great to understand how the governance structure can change these dynamics.
In any public health design for implementation, not just governance, but good governance comes to the fore. It is the arrowhead.
At this point, we'll want to see if we have any questions. Victoria, are there questions that we think are targeted towards our panelists?
Yes, so we have a question from Esha. Esha is asking about the role of digitization as a tool for awareness, reopening the economy or raising awareness about COVID-19. I think any of our panelists can take up this question.
Okay, digitization. I think we're in a digital world already. That's why we're having this meeting. So I suppose Kaduna State Government, we have used that. I mentioned about a governance continuity plan. So we still engage with our stakeholders through virtual means, and we inform our citizens of developments daily, because we have what we call a COVID-19 task force, and we've taken it in totality as One Health. So it's not just medical or you say health. We also look at it as agri-health, public health, human health, animal health, all of that in totality. So like I said, we broadcast the numbers we have of infected citizens, the people that have received treatment, those that have been discharged. And as we reopen the economy, I told you earlier that we're having a series of dialogues with traditional leaders, public schools, religious bodies. So at every point in time, we update the citizens with what is happening. But we have to recognize that in this part of the world, it's not everybody that is tuned to the digital world. So we always rely on the most popular, which is the radio. I suppose that one is a digital means of communication. We have done flyers, we have done radio jingles, we've done SMS extension. So for those, most farmers would have a phone. It may not be an Android or smartphone, where we still send SMS messages to them about what is happening. And we have media briefings. The governor releases some information as the case may be on a need basis. So it's going to be, we have to use that anyway to raise awareness and to also reopen the economy. We have no choice anyway, because right now we're in lockdown. So that's the only means to reach out to people and to bring out information and bring out decisions through those means. Thank you.
Amazing. Thank you so much, Honorable Commissioner. We also have a few comments. There's a comment here from Ijoma about the need to identify social capitals as we move ahead, and also the need to provide hybrid agricultural products and livestock that are nutritious for people, and also education and its importance. Induka also talks about community engagement. We've had so many of our panelists talk about the role of communities right now and going forward, and also in this time of the COVID-19 and how we can move forward. We need community engagement to break the cycles of denials and myths. So I think that's about the comments that we have in our chat room today. I would say, for me, I've learned a lot from our panelists. If we have any last questions or comments, can we please also put this in the group chat before we round up?
So there's a very important question around looking at how we break the denials as well as the myths in the community. And this is very important to address, given that we have had reports across the country about people who have not taken steps to believe that COVID-19 is real. I will call on any of our panelists in 1 minute to share with us an insight to how we can build a trust to draw attention in these communities. Peter, you've been at the grassroots, are you here?
Yeah, I'm with you. Are you hearing me?
Yes, we can hear you.
Okay. So in response to Unduka's questions, and thank you, Unduka, for putting this question across. Trust building has to go with purposeful leadership across board, both in terms of political leadership, and you know, there are a lot of social investment that comes with social investment and also political trust. When people entrust their lives, their livelihood, and everything they own to a particular leadership, and that leadership seems to be failing, that is where you start seeing this kind of mistrust, myths, and divergent opinion about whatever thing government is trying to push, be it good or bad. So for me, and from the experience we've had in the field, where people trust the leadership that governs over them, it makes it very easy for them to believe whatever kind of message that is coming in. So it boils on all of us, it behaves on all of us, both at the political level, at the private sector level, at the community level, religious level, every other sector at the community level, to be responsible and take responsibility of their actions. In our communities where we work, like I said earlier, people still don't believe this. They don't believe it. And the news you hear every day is that the palliative that is coming, it's something that somebody has sat somewhere and have defrauded the people. COVID is just about siphoning the pockets of the privileged few. That is the kind of message you hear in the community, not the deaths, not the infection rates, not how people should even be prevented. So, and you see, these are like carryover of people's disappointment and grievance over past neglects of governance, misgovernance in our community. So it's not just about a location, it's about the entire country. But there are pockets of instances where state governments, local governments, federal governments have done incredibly well. But the general perception of the people in our country is that they don't trust the system. And that has to do with all of us here. And I think it's one of the things we're trying to do here, to understand how it affects people from different sectors, differently, and how do we really gather our acts together to nip it in the bud. So finally, we think everybody needs to be on board. We don't need to reinvent the wheel like government is trying to do now. Recently, the federal government is about going to recruit 800,000 volunteers to sensitize communities across Nigeria. And they will pay 20,000 naira each. Now, I want to put this question again to a lot of us who are experts. Will that reduce the problem? You are bringing people who are not even equipped in the first place. Perhaps they don't even know the community they'll be sent to do this job. They don't even understand the terrain, the context, and the languages of these communities. And you are sending them to such places to go and sensitize people on issues they don't even know about, that they're not well equipped. So we are saying, utilize the expertise you have in-house. Just like we are not even importing food into the country right now, we are asked to feed ourselves with our own home-grown produce. We can also look inwards to see where we have competence and capacity and leverage on such capacities. I think that will also bring trust, because the community know people already who they work with over years, who they've been interacting with. And once those people come into the picture, the perception issue will die down naturally. So that's my take on the question.
Thank you very much. Victoria, any other question? Otherwise, we'll again.
Sorry, Victor, can I bust button here?
Okay.
Sorry.
Yes.
I just want to refer to Asma's suggestion. We had done something similar before when we have those radio engagements and those outings. We usually add something to our audience about growing crops or growing vegetables in the backyard or in old sacks and stuff like that. But her comment that it should be a targeted effort, it should be a collective and maybe more structured approach is taken into context, and I hope that we'll use that to improve nutrition of our citizens and our children. So thank you very much. I just thought this should be noted. Thank you.
Thank you very much. So Dr. Ogu, briefly tell us how policy design can help build trust and change the dynamics within the health sector.
Well, like I've said earlier, there's no reinventing the wheel. Trust comes in by knowledge, and knowledge by experience, because experience is an organized knowledge. COVID is an infection. There are existing experiences in other diseases, control, and strategies with existing policy that cut across different diseases. All it will take is learning lessons from previous intervention, use existing system where they are strong, doing a SWOT analysis, where the major strengths are identified, the weaknesses, opportunities, and threats, and then effectively create objectives around those with key activities and sub-activities that will be costed, and using existing channels to deliver services. So that is the way to go. And then developing policy issues and statements around all of those objectives, and then implementing. Thank you very much. I hope that answers your question.
Thank you very much. We are really indeed grateful for your sound participation in this event. On behalf of the family of Synagos, we want to thank all our panelists and all our audience for being with us all through this time. So final words, Victoria?
I just want to say thank you to everyone who's joined our call today. Hopefully this is the beginning of the conversation, and we'll be able to have a great outcome out of this going forward. I want to say thank you so much to everyone. Honorable Commissioner, thank you so much, Victor, as well, for moderating the panel session. That's it. Thank you.
And I want to thank all our colleagues outside and within Nigeria who have supported this process. We thank you in a very special way. This is not the end of this discussion. Our goal here is to engage with you to understand what the real issues are and look at how we will hear from you how best to bridge trust and engage with the community of practice to see how the communities and issues of the communities are able to address issues of injustice and helplessness at times like this. We look forward to future engagements like this, and we say thank you to you all. Let's all keep in touch. The network is one that we must keep alive. Thank you very much.
Thank you. Thank you. Thank you very much.
All right. Thank you.
Thank you.
Bye-bye all. Thank you.
Bye. Bye.
Ciao.